Hello, my name is Anita O'Donovan and I'm the Postgraduate Course Director for the discipline of Radiation Therapy. And today I'm going to talk you through our postgraduate options in advanced radiotherapy practice. So first of all, I'll go through an introduction as to why a master's programme might be relevant or beneficial for you. I'll talk about the strands that we have available within our master's programme, the online learning environment. So our master's is fully online, and I'll talk you through some of the features of our virtual learning platform, as well as the assessment requirements, the admission requirements, how to register, and where you can direct any additional queries that you might have. So first of all, I'm sure you're fully aware that the demand for radiation therapy is increasing worldwide, as is the complexity of our treatment. And we very much work in a rapidly changing and dynamic profession, and the demand to keep up to date is ever present. And this postgraduate programme attempts to keep you up to date by providing an opportunity to learn about the most recent evidence base and gain advanced skills for clinical practice. And the main aim being that we will have skilled frontline staff who are able to facilitate the expansion of services, and our course very much aims to equip you with those advanced skills that you will need to meet this demand, so current and future demand within the profession. So we have two separate strands available to you. They are the clinical practice strand or treatment planning, and there are also a number of entry routes. So we have three entry routes: the certificate route, the diploma route, and the master's route. So you might choose to undertake any one of these, and you can use the certificate and diploma to eventually build to a master's, or you can choose to exit with a certificate or exit with a diploma if that is your choice. So I'll just go through the different features of both of those now. So again, the certificate and the diploma options are outlined here, and the certificate route, first of all, is over 3 years, while the diploma is over 2 years as routes to a master's if you didn't register for the master's firsthand. So first of all, if you register for a postgraduate certificate, it's a slightly slower pace, and often people find this quite beneficial if they haven't studied in a long time. So it allows you to complete 3 modules in year 1. And again, you can exit with a certificate at that stage, or you might choose to go on and do the top-up diploma, which is an additional 3 modules in year 2. And then finally achieving your master's in year 3 by completing your research dissertation. Then the postgraduate diploma option allows you to do 6 modules in year 1. So again, a slightly faster pace, and your research dissertation in year 2. So those are additional routes to our master's programme. So you can start with either a certificate or a diploma, first of all, if you're uncertain about whether or not you will end up completing your master's. So these are the certificate modules for the treatment planning strand shown here. So the first being delineation for radiation therapy planning, and delineation covers the skills to accurately outline organs at risk. So best practice with regard to OAR, delineation and target volume for radiation therapy planning. And the sites that are covered in this module are prostate cancer and head and neck cancer. The imaging module, on the other hand, looks at the imaging modalities that are used in diagnosis, staging and treatment delivery, while specialist radiation therapy techniques aims to expand your knowledge on stereotactic radiotherapy, adaptive strategies and MR guided radiation therapy. So having completed the certificate modules, again, you might go on to complete the diploma, which includes these additional modules shown here. Treatment planning for modulated techniques covers the fundamentals of treatment planning with an emphasis on how planning for modulated techniques such as IMRT and VMAT differs from conventional planning. Proton therapy then is looking at the treatment of malignant disease and the clinical indications for proton therapy. As you know, the number of proton therapy facilities is increasing across Europe, and this module looks at the physical and biological basis for proton therapy, as well as the practical planning components, so how you can plan an actual case with proton therapy. And finally, research methods looks at developing your research skills for your clinical practice, and also enables you to develop the skills you will need to go on and complete a research dissertation as part of a full MSc. So the clinical practice strand then, these are the certificate modules for the clinical practice strand. So the first is Advances in Radiation Therapy, which looks at evidence-based management across a range of cancer sites and allows you to critically evaluate your own practice, as well as provides the potential to enhance your clinical practice. Delineation for radiation therapy planning, as before, looks at accurately delineating organs at risk and target volumes for radiotherapy planning. And then imaging for advanced radiotherapy practice covers the main imaging modalities for diagnosis, staging, and treatment delivery. So the 3 additional modules then for the diploma are management skills for healthcare professionals, which focuses on basic management skills such as project management, leadership, and negotiation, as well as quality and safety. So looking at implementing lean healthcare and risk assessment and quality improvement methods. Radiobiological principles and practices provides an understanding of the biological interactions of ionizing radiation and its potential in cancer treatment, and looking at the applications to clinical practice in terms of treatment planning, dose restrictions and calculations, as well as alternative fractionation schedules. And then finally, research methods, as before, looks at applying research skills to clinical practice, and again allows you to gain research skills to complete your dissertation. So in terms of the structure and how they're delivered, one module is typically delivered across 9 weeks. So you have 7 weekly sessions with new content released on a weekly basis. And the online tutorials then run after the content has been delivered in the first week. You'll have your first online tutorial, and they are continued through weeks 2 to 8. So every week, usually at lunchtime, to give people the flexibility if they're working full time to be able to participate. You have a weekly tutorial with the module coordinator, and then your assignments are typically due in week 9. And in terms of the release timetable, you can see here on the right-hand side, the first release is September to November. And depending on if you're doing the certificate, you'll have 1 module to be completed within that time frame, or it might be 2 modules if it's the diploma or the full master's. Then the second time frame is November to February, with a good break at Christmas time, and then February to April. And that is how the content is delivered. And you can see here the format of our virtual learning environment. It's facilitated by Blackboard Learn. And again, it's quite nice. It's an interactive interface. So all of the interactive features that students can use and that we regularly use in our modules are shown here. So announcements are just module announcement from the module coordinator, but you might be asked to complete a blog, or this is the module collaborate room, which is where tutorials take place. We have our module learning journal, which is a reflective journal for individual students, but also the module discussion forum, where you, as part of each session, we typically have a post to this discussion forum where we invite students to post their observations or their experience, maybe in clinical practice, and it's a nice way to engage with fellow students. And then you've all of the content here, which again is released on a week-by-week basis. So every session becomes available on a certain day every week, and the associated learning material is contained within each of these. So the PACE is, I suppose it's a bit more student friendly. And then we, within each session, you can see here that we have an introductory piece where we just introduce you to the topic and what we're aiming to achieve. The prepare task might be something for you to post maybe to a discussion forum, maybe your prior learning or understanding or experience maybe in relation to the topic. And then the study component contains all of the learning materials, so the recorded lecture and associated slides. And then we also have the apply and reflect components where you can apply your learning or reflect on it. We also have a recall section where you can maybe do a quiz or complete a task sheet to make sure that you have understood the main concepts. And finally, we also have an extend section where you can extend your reading and achieve greater depth on the topic by reading additional papers that have been highlighted by your module coordinator or additional resources maybe. And finally, our collaborator, our webinar platform, this is what it looks like. So you can see it allows us an opportunity week by week to go through all of the content, all of the relevant sections, and to make sure that the understanding is there, or to take any questions that students might have. We also have quite nice interactive features, as you can see on the right-hand side. There's a chat function that students can use to interact with the module coordinator or with each other, or they can also use their microphone. And again, these are 1-hour tutorials every week, and it's just a nice way for students to keep focused and to put a bit of structure on the online program. And finally, with regard to assessment, so for the assessment requirements, there's a lot of continuous assessment throughout the course, and that comprises essays or case studies, maybe online discussion or participation, for which we award a small mark, which is quite nice, reflective assignments, or for the treatment planning strand, generation of treatment plans, or plan evaluations, for which you will need to have access to a treatment planning system. That's one of the requirements. And in the master's year, the assessment, of course, will be your MSc dissertation. And the requirements then, so the admission requirements are, first of all, you have to hold an honours primary degree in radiation therapy, medical physics, medicine, or a related discipline, or otherwise satisfy us that you have the ability to complete our master's programme. And that might be by showing us evidence of previous academic qualifications, or maybe evidence of relevant professional experience. You also have to have access to a radiation therapy planning software for the duration of the course. And you also have to have English language proficiency. So for students whose first language isn't English, you have to meet the university's English language requirements, which are shown here. So you have to provide one of these to, again, fulfill the university's English language requirements. The paperwork required, and it's a good idea to start thinking about this now, because sometimes it takes a little bit of time to gather all of the relevant documentation, a copy of your degree or qualification, a full transcript from any prior courses that you've done, your CV, your European Union fee status documents, if that's applicable, if you're going to be an EU student. And these documents are detailed on the academic registry website. The name of 2 referees, one has to be an academic referee, and a letter of support noting access to treatment planning system. So how you can register, first of all, you can visit the course website. Again, all of the information I covered today will be covered here, and that will allow you to register. Click on the apply icon, enter your details. You have to upload all of the relevant documentation that I've just gone through. And if you want to know more about the fees, all of the fees for the individual routes are on the academic registry website. And if you have any other questions, anything I didn't cover today, please feel free to email us directly. This is our postgraduate email address, and feel free to get in touch if there's anything you want to ask. So finally, this is our to-do checklist. And again, worth noting, if you are interested in applying for a master's, it's worthwhile to start gathering this documentation now, because it can often take a little bit of time to get all of the relevant documentation together. And thank you for your attention. I do hope you will be in touch with us and that you will end up applying for our master's programme, and do get in touch if there's anything additional, any additional queries that you have.